Hello, my name is Karen, and I am an occupational therapy student at Kaiser University's MSOT Bridge program. As part of my virtual fieldwork experience, I am creating weekly YouTube videos discussing various topics about what I've learned during the week and also different assignment topics, such as this week. Our assignment was to create an intervention strategy to use with a pediatric client that uses various items you can find around the house. So, for this activity, we also had to make sure that our intervention was focused on visual perceptual skills. Today, I will be addressing this using highlighters and rubber bands and hair ties. I'm going to be focusing on the visual perceptual skill of copying. And in my example, I'm going to be working with a child who is elementary age and having difficulty in school copying down her assignments from the board. She frequently confuses and jumbles her words and sentences together and is unable to copy her assignments down to her paper in a decent amount of time. My goal that I am working towards is going to be the child will copy 3 out of 5 sentences from the board in 15 minutes with standby prompting in 3 months. To address this goal, I am going to go ahead and start my intervention activity. This is going to be using the highlighter, and I'm going to provide her with a pre-made set example that she's going to be copying. So before she came in, I went ahead and put these bands on my highlighter, and I went ahead and did a simple pattern of green, red, green, black, green. So what she's going to do is have to copy this on her own highlighter. This can be used with any item, a spatula handle, a hairbrush handle. You can use a wide fat crayon, anything that's going to be long and cylindrical that she can hold with both hands. Also, although this assignment is working on visual perceptual skills, this has the added benefit of getting bilateral hand coordination in, as she has to grip the highlighter with one hand and use the other hand to wrap the band around. The performance skills I am addressing in this activity are heating, attending, searching, organizing, pacing, manipulating, and grip. The client factors I am addressing are attention, memory, visual functions, and control of voluntary movement. These factors and skills are addressed not only in the activity I am having the child do, but are also related to her copying goal that I made for her. So, with this activity, she can keep the original demo with her in front of her in order to copy the pattern onto here. To make this activity easier, I can also eliminate some of the colors. So instead of using 3 colors, I can go ahead and have her just do 2, like green and black. To make it easier, I can also make sure that I'm using contrasting colors. So if she were to be doing this on the green highlighter, green on green is a little bit harder to see, so I would make sure to not use the green if I wanted to make this activity easier for her. Something else to keep in mind as well is the size of the rubber band. With these green rubber bands, they're pretty small and it can be kind of tricky to make it fit twice over, whereas with a larger rubber band in the circumference is a whole lot easier to slip on. Plus, the wider material of this hair tie is easier for me to grip than the smaller rubber band. You can also see that the wider material of the hair tie kind of stands out more and is a little more 3D and easier to see. To make this activity easier, I can also use a predictable pattern. So instead of just throwing rubber bands on here randomly, I could go in that set pattern of green, black, green, black, green, black. To grade this activity up, I can use more colors and then do that random pattern as mentioned before. This way she's having to actually think it through and not fall into a routine. And I can also have her only look at the pattern for a select amount of time. So she can go ahead and look at this for 30 seconds and then I'll take it away and have her try to copy it on her own. Or I can limit the number of times she's allowed to look at it, such as, okay, look at it once, make your attempt, and you only get one more look before you have to turn in your product. There are definitely different ways you can use this activity as far as adapting it and making it easier and more difficult. As I mentioned before, if she's having a hard time holding this, while this is more of a physical limitation, not a visual perception, I can get a larger handle for her to hold. Also, if I wanted to make it more challenging and work on pinch as well as her visual perception skills, I could get a smaller pencil to work with. Thank you so much for joining me this week on how we can use common items around the house to address visual perceptual skills in children.